Joint pain is one of the most misunderstood health problems in older adults. Many people are told that aching knees, stiff fingers, and painful hips are simply a normal part of getting older. But that belief is not only wrong, it is dangerous. The real problem is not aging itself. The real problem is chronic inflammation slowly damaging your joints year after year. And the good news is this: there is one cheap, widely available food that research shows can reduce joint inflammation by up to 65%, even in people over the age of 70. Here is why this matters so much. If you are over 60 and your joints hurt when you stand, walk, or wake up in the morning, you are not just dealing with discomfort. You are facing one of the biggest threats to independence in later life. Studies show that joint pain is one of the leading causes of falls in seniors. Falls lead to hospital stays, surgeries, long recovery periods, and in many cases, permanent loss of mobility. Once joint damage reaches a certain point, it cannot be reversed. Cartilage does not regenerate easily. That is why ignoring joint pain, or simply masking it with painkillers, can quietly push you toward disability. This information comes from decades of clinical experience and research by specialists who focus on inflammation, aging, and joint degeneration. Doctors who have treated tens of thousands of arthritis patients consistently see the same pattern. Seniors who control inflammation early maintain mobility longer, while those who ignore it decline rapidly. To understand why, you need to know what is happening inside your body. Your joints rely on healthy cartilage, lubricating fluid, and strong connective tissue. As you age, your body enters a state called chronic low-grade inflammation. This inflammation activates destructive enzymes that slowly eat away at cartilage. It thickens joint fluid, making movement harder. It weakens the collagen that keeps joints stable. And it increases pain sensitivity, so even minor damage feels severe. This is not wear and tear. It is an inflammatory process. One of the most harmful mistakes seniors make is relying solely on painkillers. While these drugs reduce pain signals, they do nothing to stop inflammation from destroying joint tissue. Long-term use is linked to kidney problems, stomach bleeding, and faster joint deterioration. Another mistake is avoiding movement altogether. When joints do not move, they receive less lubrication and nutrients. Inactive seniors lose cartilage faster and become stiff more quickly, creating a cycle of pain and immobility. Perhaps the biggest mistake is believing that food has no impact on joint health. In reality, diet plays a major role in controlling inflammation. Diets high in refined carbohydrates and processed foods dramatically increase inflammatory markers in the body, accelerating joint damage. Now let's talk about the solution. The food that has shown remarkable results in reducing joint inflammation is turmeric. Specifically turmeric combined with black pepper. Turmeric contains a compound called curcumin. Curcumin blocks multiple inflammatory pathways in the body. It reduces the production of inflammatory cytokines that attack joint tissue. It protects cartilage from oxidative damage. It improves joint lubrication and helps preserve collagen structure. Black pepper is essential because it increases curcumin absorption by up to 2,000%. Clinical studies involving adults between the ages of 65 and 85 show significant results. Participants experienced up to a 65% reduction in inflammation markers. Many reported noticeable pain relief within 4 to 8 weeks. Walking ability improved, stiffness decreased, and daily movement became easier. Using turmeric safely is simple. Half a teaspoon of turmeric powder combined with a pinch of black pepper, taken once daily with food, is enough for most seniors. It can be mixed into warm milk, soup, tea, or oatmeal. Anyone taking blood-thinning medication should speak with a doctor first. Supporting foods such as olive oil, fatty fish, and bone broth can further protect joint health by improving lubrication, reducing inflammation, and supporting connective tissue. If you are over 60 and want to stay mobile, this information can make a real difference. Supporting your joints today means protecting your independence tomorrow. Joint pain does not mean your body is failing. It means your body is inflamed. And inflammation can be reduced. By taking action now, you lower your risk of falls, reduce the chance of surgery, cut medical costs, and preserve the freedom to move on your own terms. Aging is unavoidable. Losing mobility is not. Your joints carry you through life. Take care of them now, so they can continue to carry you forward.